by Bernie So and Jaya. The common question is, what is pre-implantation genetic diagnosis? Many people might think that PGD is a sort of genetic change which helps create the future generation and turn them into superheroes, as their gene pool would most probably be flawless and perfect. However, although some aspects of that definition is right, PGDs only prevent certain types of diseases before pregnancy using intravitreal fertilization. It definitely does not make someone a superhero by just changing a few aspects of their genetics before they were even born to prevent having diseases. Pre-implantation genetic diagnosis is a technique that enables people with a specific inheritable condition in their family to avoid passing it to their children. It involves checking the genes of embryos created through IVF for the genetic condition. Therefore, the ethical question is, should parents be allowed to change their child's genetics in order to prevent future illnesses and diseases before they're born? In our defense, yes, we agree that parents should be allowed to genetically design their child as it helps maximize harm by preventing diseases and harm. By that, it helps maximize benefits for the child's future. In other words, PGD helps maximize benefits and minimize harm. Pre-implantation genetics involves carrying out tests on embryos created through intravitreal fertilization, which is a process by which an egg is fertilized by a sperm outside the body, or intracytoplasmic sperm injection, an fertilization procedure in which a single sperm is injected directly into an egg, help detect certain inherited conditions or abnormalities. This helps to ensure that only uninfected embryos are selected before they are transferred to the womb. Conventional prenatal tests for genetic diseases cannot be carried out until the 12th week of pregnancy. Testing embryos before they are implanted could help you and your partner to avoid having to make the difficult decisions whether to have an abortion if either of you is the carrier of a genetic condition and the embryo is infected. With pre-implantation, it is also possible to change character traits such as eye color, hair color, and height. Instead of using PGD to prevent future risks such as diseases, PGS is a misuse by many people to design and make their infants more attractive by changing their physical features. How does PGD work? The procedure of PGD is likely to be as follows. Step 1. You undergo normal intravitreal fertilization treatment to collect and fertilize your eggs. Step 2. The embryo is grown in the laboratory for 2-3 days until the cells have divided and the embryo consists of around 8 cells. Step 3. A trained embryologist removes 1 or 2 of the cells from the embryo. Step 4. The cells are tested to see if the embryo from which they were removed contains the genes that causes the genetic condition in the family. Step 5. Embryos uninfected by the condition are transferred to the womb to allow them to develop. Step 6. Any suitable remaining uninfected embryos can be frozen for later use. Those embryos that are affected by the condition are allowed to be perished. Step 7. About 2 weeks after the embryo transfer, the woman is given a pregnancy blood test. The 3 alternative options. Number 1. Allow parents to change the traits. Number 2. Do not allow completely. And number 3. Only allow them to change certain changes. For number 1, allowing the parents to change any traits that they want to include in the character of traits. This solution does not show any bioethical principle. Instead, this option just enables the parent to be choosing what they would want their child to look like. By doing this, the child has no say for themselves and does not show the principle of rights for an individual. For parents who would most likely change their traits to what they want themselves to look like. From a person who believes in Christ, they would strongly object to this idea as it would be going against their belief of life starts as soon as the baby is conceived. From a doctor's perspective, they will be willing to do it even though they might not be agree with the situation as it's their job and they have to carry it out properly. Number 2, which is do not come out completely. In order to prevent people from misusing this process to create designer babies, make pre-implantation unavailable completely to everyone, as there are much misuse than used for good. For example, parents use it to create designer babies, which is actually unnecessary as it's only for their pleasure. Also, it violates one's right as an unborn child cannot speak for themselves. From the parents' perspective, it will be disappointing to them as though they cannot create what they want and what's their ideal child. They will not be permitted to do so. From a perspective of someone who believes in Christ, they will agree to this idea as they believe that God has created one exactly the way he wanted him, the way he did, for a specific reason. From the doctor's perspective, they will not like this option as if it's not allowed. Doctors will be losing more jobs and their income would not from doing pre-implantation. Step 3. Only allow them to change certain changes. Only allow a change to prevent from diseases, not character traits. This solution shows the principles of minimizing harms and maximizing benefits. If it's only possible to prevent something bad from happening before it actually happens, it will be very beneficial to the child. However, this actual process was created for it and is not misusing in any way. From a parent's perspective, they would maybe like this idea as it would be still preventing diseases which will not cause any harm to their child. From someone who believes in Christ, they will object it as they said is still changing a child's traits. From a doctor's perspective, they will agree as they will benefit from the child, and the doctors will still be able to carry out their jobs and help others, which is also demonstrating maximizing benefits and minimizing harm. Decisions and justifications. In our opinion, we strongly feel that the parents should be allowed to only change certain traits which will prevent their child from having future diseases. By choosing this solution, it will strongly prove the ethical principle of maximizing benefits and minimizing harm. Instead of allowing the other two solutions, which is to completely allow or disapprove pre-implantation, this way, parents will be allowed to save some money in their finances as if the child were to be born with a sickness or a disease. The amount of money which will be spent on treatment and medical will be very costly. Also, allowed to change traits for a disease, it fully utilized pre-implantation for good cause. If parents were allowed to make changes to any trait they want, they may choose something that they might regret in the future. The parents will feel guilty about it and will not be able to do anything about it as the child grows older. Moreover, if something is wrongly changed by the doctors, the child has to suffer with it for the rest of their life. It may be caused due to being unfamiliar with changing other traits such as their gender, hair, or hair color. Changing the trait leads to disease, which is much simpler and commonly conducted. In conclusion, the best solution would be